Thank you, Chair, Honourable Minister. The ACDP is concerned that health services throughout the country are not keeping up on an equitable basis with new technology, and that many health facilities offering maternity and CTOP services do not have basic ultrasound equipment or suitably trained staff for that matter. Now, much is being said in other departments about keeping up with the technological revolutions that the world has experienced and is continuing to experience, and yet the most scientifically based sector traditionally is arguing that basic technology like ultrasound equipment is not necessary in all health facilities. Maternal and child deaths, which are still a concern in South Africa, have received significant attention, especially in view of the Millennium Development Goals and now the Sustainable Development Goals. And what has been noticeable and a little odd is that stillbirth targets were omitted from the MDGs and remain absent from the SDGs. It is peculiar for many reasons, but not least of all the fact that giving birth to a stillborn infant is one of the most heartbreaking and tragic events for any parent and their family. These babies die either during pregnancy or during the process of giving birth. In a ranking of stillbirths in 193 countries by the Lancet Medical Journal, South Africa was placed at 148. Now, the causes of stillbirths are closely connected to the same influences that affect maternal and newborn mortality, which are often identified too late, if at all. And while more research is necessary to understand the causes of stillbirths before labour, we do know that cleanliness, infection prevention, reduced waiting times, drug availability, and improved staff attitudes have been identified as important factors in improving management of labour and delivery. And the ACDP calls on the Minister to take radical steps to improve management of labour and delivery. We're calling on the department to recognise that significantly reducing child and maternal mortality and even stillbirths will need more than just increased access to abortion, and to provide women with scientific information about their pregnancy. Make ultrasound equipment available in all health facilities. Train health professionals in line with this technological age that we live in. This must be a basic norm. The World Health Organization, whose guidelines and instructions are followed so closely by our health department, according to their own testimony, has stressed the importance of ending what they call preventable deaths in reference to stillbirths and maternal and child mortality, and yet oddly insists that ultrasound equipment is not needed where maternity and CTOP services are provided. The ACDP calls on the department to ensure the training of healthcare workers includes the importance of counting every birth and every death. Healthcare workers are well placed to assist in providing relevant help and information, as the grieving from a stillbirth or CTOP is often left to the mother to shoulder alone. The ACDP calls on the Minister to ensure budgets extend to counselling of women experiencing stillbirths and termination of a pregnancy which prevents a live birth. The ACDP will not support this budget, which is discriminatory and not prioritising adequate protection and services for moms and their babies. I thank you.
Thank you, Honourable Dudley.